This video has been edited and the written portion will be submitted separately. Okay, Claire, to continue with our assessment, I'm just going to do a body scan to look for any lines of pull in your fascia and skin. So just stand nice and relaxed. I'm just seeing where there's some pull actually towards your right shoulder. And almost like there's a bit of a torsion coming around your abdomen, but also a bit of a side bending towards your left side, towards your hip. And in your yoga pants, where I'm feeling that they're seeing any pulls is actually under your left knee, so there's a little something there. If you can turn around. And from here, noticing a little bit again around right shoulder and a pull. Yeah, it seems like there's a little bit around that lower right, and into the left is still doing kind of like a side bend pull in through there. Okay, so now I want to do something called the Stork's test. So I'm just going to pull this up a bit. I'm going to landmark at your PSIS and your S2 vertebrae. And I want you to stabilize on your left foot, and you're going to lift your right knee up and back down. And I'm looking for an inferior motion of the PSIS in relation to S2. And yours moved well. And now the left. And, and back down. Okay, so that one harder for you to stabilize, but the PSIS did have movement, just not as well. Now you're going to abduct your arms up. Perfect. And you're going to do the left again. And back up. And just landmark. And now the right. Okay, and back down, and you can relax your arms. So having the arms up adds increased tension, and because the left wasn't moving as well as the right, when you had your arms up, it actually got worse, and that tells me that you already have a lot of tensions in your pelvis, and having the arms up, which increases some fascial pull through your latissimus dorsi muscles, has amplified that tension. So if you can come lie on your back, you can put your head on the little pillow. And I just want to check movement for any compensatory patterns. So we start at your OA, and I just want you to stay nice and relaxed in your neck. I'm going to fully flex it here, and I'm just going to rotate to the right and to the left. And you are definitely have more of a restriction to the left in comparison. Okay. Then I'm going to come to your cervical thoracic here under your shoulder blades. And this side. And it's the opposite. You have more lift on your left, more restricted on the right. Then I'm going to come to your thoracolumbar on the lower ribs. Just do a bit of a rotational movement there. And this side is more, I would say, the left. So left, right, left. And then we have your lumbosacral. So just come around your hips. And also do that bit of a lifting rotational movement. And in this one, it is more the right seems a bit more restricted. So we would call that a common compensatory pattern of a left-right restriction movement. Now, if you could turn over onto your stomach, you can put your face in that little face cradle. And I'm going to check your pelvic diaphragm. I have to put my hands on your buttocks. So you already had given me consent for assessment and treatment, but if at any time this is uncomfortable, you want me to move my hands, please let me know, okay? Mm-hmm. Okay. So what I want you to do is do nice deep breaths in and out. And again. And I feel on inspiration, it drops inferiorly, which is a good motion. Excellent. And now I'm going to put my hand on your sacrum. So you just keep breathing. inhalation, it should extend or counter-nutate. And on inhalation, in exhalation, then you are flexing and nutating. So inhale, extends, yes. Okay, so it has a very limited movement in both your breathing patterns, which would be indicative of potentially some sacral restrictions, which based on your symptom picture and our assessment, you do have some sacral concerns. Okay, and now I am going to, is it all right if I fold this down? I just want to assess your fascia in the low back, since that was an area of stiffness for you. So I just want to have soft hand pressure. I'm going to just sink into the tissues a little bit to engage the fascia. And then I'm going to do a little bit of a glide, superior and inferior. And I want to go to where it's more in ease, which is superior for you. And then I'm going to add a bit of a torsion, so rotating in one direction and the other. Oh, and you definitely prefer right rotation. So I'm just going to hold this position, and we want to wait 30 to 60 seconds minimum just to have a tissue unwinding. And as I feel it soften under my hand, I can come out and then re-engage. And I'm going to actually go a little bit into the deeper structures just to have a sense of what's happening there. And I feel quite a lot of resistance. The tissue feels a lot harder and more firm under my hand, and I'm hitting more restriction in my glide and torsion. And I want to do something that we call around the clock. So I'm going to engage the tissue again and then move 12 o'clock. 1 o'clock, and so forth, and just feel where there might be any restrictive movement in the fascia. And for you, 8 o'clock seems to be the worst. A little still tight in 9, but not as bad, and then freeze back up again. Okay. All right. If you want to sit up for me. So based on your symptom picture and the assessments that we've done so far, based on what I've learned in my program, I feel that you have a flex sacrum on the left and your left pubic tubercle is high. So those imbalances in the bony structures are going to put a lot of tension in your muscles, ligaments, and the fascial attachments in the pelvis. So that can restrict blood flow, which can lead to the pain that you're having. Mm-hmm. And also with the deep fascia being tensed up, it can compress on the nerves that are traveling in that region, which could be what's causing your referral pain to the groin and the adductors. So what I'd like to do for treatment today is 2 fascial techniques and then 2 osteoarticular techniques. So one is called a lumbosacral decompression. So we're going to help release the low back and the sacrum, the fascia there. Then we're going to do working the abductors of your hip, because that's where you have quite a lot of hip pain. And then that's a really great prep. It helps to decrease your sympathetic nervous system response and decrease pain. And then it's a wonderful prep to do the more structural techniques. Mm-hmm. So then I'm going to do a sacral readjustment to help get that flexion back into a better alignment. And then we're going to do a technique for your pubic bone and do a reassessment. Okay. So if you have any questions or concerns, then let me know. Okay. So to start, you're going to lie on your back. And if you can just roll this hip a little bit away from me so I can put my hand on your sacrum. And if we can lift your shirt off. Sorry, thank you. And back down. And my top hands on your spinous processes of S4, S5. Okay. And I just want you to have nice relaxed on the table, nice even breathing. I'm going to be slightly almost lifting my hands up into the tissue and bringing my hands together to engage the fascia. And then I want to wait for the tissue to soften and start to release, and I should feel your sacrum drop more into my hands and move inferiorly. Yours is quite restricted. So what I want you to do is put your hands on the front of your pelvic bones, and you're going to squeeze them together towards midline just with a little bit of pressure. Perfect. This helps to open up that SI joint, and immediately I am actually feeling your sacrum start to drop into my hand. Is that comfortable for you to keep doing? Okay. And now I'm feeling there's a bit more of release. You can relax your hands. And I'm just going to stay until I feel the sacrum move inferiorly. That is wonderful. Nice. And as I come back to bring my hands together and up, I already feel a lot more give, and there's a bit of a heat response coming off of the low back. Excellent. So our next technique, I want you lying on your right side. Put this pillow under your head. Okay. So I'm going to put my forearm, and this might be a bit more tender, so let me know. And I want you to very slowly clamshell your upper leg up, if you can. And back down, just go nice and slow and just keep repeating that movement while I'm holding tension at your glute. Excellent. Okay, and you can relax that. I'm going to move more around your greater trochanter. So I know this might be a bit sharper pain for you. Is that okay? Okay. Now I want you to very slowly try to flex and extend that upper leg. Yeah, and it might not be a lot of movement. That's okay. Excellent. I'm going to just change my position. Perfect, and do that again. Excellent. Yeah, I really feel like there's a softening under my arm, and your movement seems a bit freer as well. Great. Okay, you can relax your leg. Okay. So now that we have released some of the fascial tensions in this area, I'm going to have you roll onto your stomach, but you are going to have your legs down off of the end of the table a bit. Perfect, right there. You're going to open it up so that your SI joint is open, and it is your left sacrum that was flexed, so you're going to turn your head to the left. I'm just going to have superior pressure on the left side of the sacrum. And I want you to breathe nice and deep in and out repeatedly. And I'm going to hold for 10 seconds. And then I'll relax. And I want to repeat this 3 to 5 times. So again, I'm going to engage superiorly. And relax. And one more time. And relax. And I'm just going to oscillate your sacrum just to help integrate that adjustment. So if you can put your forehead back down onto neutral, I'm going to just retest. We're going to check the deep sulcus, and it has become even. And I'm going to check your inferior lateral angles, and they also are even. So that was a successful adjustment. And while you're in this position, I'm going to just redo that clock I had just done earlier, just to see if there's any change in specifically that 8 o'clock. So I'm just going to sink in. 7. And there is also more freedom of movement in both the 8, 9, all the way up 10. So that is great. Okay, so now we're going to have you roll onto your back. And I want to do that pubic bone. There we go. So knees bent. Lift your bum up and then down. This helps to reset the pelvis. So first we're just going to warm up the tissue. So you're going to open your legs. I'm going to have my arm between. And I want you to squeeze with just 10% force. Okay. Just for 10 seconds. And relax. And then together you're going to press apart, just 10% force. And relax. Let's do this one more time, 10%. And relax. And apart. And relax. Now, this time, you're going to do 100% contraction, but super quick. It's just going to be a contract, relax. So when you're ready, contract, relax. Try that one more time. Contract, relax. And I don't know if you noticed, there was just a tiny little kind of a shift pop. So let's see. Put that down. If we were, can you just tell me where your pubic bone is with your fingertips? And I'm going to come down with the heel of my hand. Now, when we first assessed this, you had quite a lot of pain as well. Mm-hmm. I'm noticing that did adjust it. I'm finding both tubercles are even. How is the pain with palpation?
It's not the same as it was.
Awesome. Okay. Now, if you want to come off the table gently, just stand right there facing me. We had done a forward flexion, and you had quite a lot of decreased mobility in that motion. Can you try that again, reaching down to the floor? And how does that, you already can go more.
Yeah, it feels a little better the last time. Yeah.
And then with your left hip, when we did an abduction, you had some pain.
Yeah, it seems like there's less pain.
Yeah? Okay.
Less pain, yeah.
So I think that was a pretty good first session. We are going to have you come back in a week for a follow-up so I can do a reassessment and see how your symptoms have been. I'm going to send you home with some exercises, some stretches, and a hydrotherapy for you to do during this week. And then we'll touch base again.
Okay, thank you.